To see you. Would you like to introduce yourself and who you are and who you represent?
Right. I'm Bob SALTZ. I'm with the Prevention Research Center in Berkeley, California. We're a national center for research into the prevention of alcohol-related problems. And I've been there since 1983 when we started the center.
Oh, okay. And so the work of the Prevention Center is different than many other centers which have a different focus, right?
Right. Many of the other alcohol centers focus on, for instance, biomedical research or treatment. And ours is the only one from the National Institutes of Health that's funded to do work on prevention. And at the time we started in the early 80s, it was unusual because we had a focus on so-called environmental approaches to prevention. In that day, the overwhelmingly popular approach to prevention was to infuse curriculum in schools with, information about alcohol and the dangers of addiction and the rest, and in the hopes that that would inoculate young people against the likelihood of developing problems with alcohol. And these programs at the time were very ineffective. And our approach as a center was to look at all the other things in the environment, the legal environment, the social environment, the economic environment, that could be used to reduce the prevalence of alcohol-related harm, like drunk driving, crashes, and the rest, assaults.
So how do you feel the field of alcohol prevention has evolved from 1983 to today? I mean, do you feel that that the environmental approach has become more widely accepted, or?
Yes, well, it's a little bit of good news, bad news, as the cliche goes. The good news is that the environmental approach is no longer some kind of novel thing that it was when we started. Many people understand now a kind of public health approach which sees that while you focus on individuals who have problems with alcohol and you want to provide either treatment for the most severely addicted or other kinds of interventions for people that are just high-risk drinkers, the universal approach to prevention, which it looks for shifting the distribution of alcohol consumption in ways that reduce harm across an entire population, that's a legitimate approach now, whereas in the early days of our center, this may have been seen as a questionable approach. So that's good. The limitation is now that we've demonstrated some of the efficacy of these approaches, the density of outlets, for instance, the tax rates, ways in which servers can be enlisted to reduce intoxication among patrons. Now that we know these things can be effective, what we haven't got a good handle on is how to get them implemented. And now the focus, I'd like to think of our current research, is how do we get communities to adopt some of these strategies? And it's not even, there are many barriers to getting implementation and adoption of these strategies. A lot of it just has to do with inertia, and a lot of it has to do with the fact that still the public doesn't quite understand the value of these environmental approaches and think that they're not effective when they are. So we have to kind of come across all of that and develop these strategies for implementation, which are different than the strategies you want implemented. Mm-hmm. But these are typically kind of expensive approaches to do community prevention, so it's difficult to get funding for them. And so we have to simultaneously look for new ways to partner with communities, with other agencies, with the public at large, to try to set up a rigorously designed study on what should those strategies be. And it seems to me that's where we're at now in the kind of work we need to do. We'll continue to develop new and novel strategies for prevention, but what some call translational research, how do we get that into the field to practitioners? And that's an enormous challenge that we haven't quite figured out yet.
Now, you and I started to collaborate in the early 1980s, first around a research project that was developing a model, Dram Shop Act, a model, a Liquor Liability Act, because the premise of that was that, as the way I understood it, that the current legal system that was involving civil liability against venues who overserved customers or served underage people who later were involved in a situation that resulted in injury or fatalities, either among the person who was drinking or those that they impacted. But that the court system was very much limited. Was the person drunk? Did the person serve them? And was there an injury? And that was the basis of liability, but no real guidelines in the conclusions of the lawsuits that would provide not only the venue operators to improve their practices, but insurance companies to better manage risk. Mm-hmm. Now, I know there was about 6 or 7 states that adopted that defense, but dram shop has always been seen, or for those who don't know, dram shop is just a term that was coined when alcohol used to be served in drams and you drank them in dram shops, almost what we call today taverns or bars or whatever. But the dram shop or liquor liability was often seen as a environmental or a strategy that you would work from a different perspective, mm-hmm. not necessarily directly with the drinker or the patron, but one that would be looking at those who serve, but incentivize businesses to adopt responsible practices. Looking back on that early work and that early research, how well do you feel the concept or the approach is still a viable one?
Well, that's just one tool for implementing responsible beverage service. If servers and, more important, their managers believed that they were subject to that liability with severe repercussions for serving somebody who later harmed somebody else, for instance, I think that would be, I think that could work well. The trouble is that as best as we can figure out, and I've worked with people like Jim Mosier and Harold Holder on doing some of this research around liability laws, is that the laws vary from state to state, sometimes from region to region, and owners and managers aren't even quite sure what their liability is today. So we had a survey we did years ago of managers, and some of those in the states like California where liability risk was very low still assumed they had some liability risk. And in states where the risk was high, they didn't even know that. So, and insurance rates, surprisingly, also did not reflect the liability, the risk of liability. So it's a complicated world. So I think this could be used to motivate owners and managers, but I think just as salient are strategies in which we get owners and managers and staff to think about their role in the community and in saving lives, because that's what they can do. They're the last people that are going to see somebody who might be capable of driving and crashing into someone else. And that, I think, is seen, it's a universal kind of motivation. It doesn't depend on what the insurance climate is in their city or on legal cases in the state that are difficult to interpret for them. So we're working right now in El Paso with bars and restaurants that are mainly staffed by Spanish-speaking employees, and we're pressing very hard on the issue of being a good community member. And I think we're having some success there, getting adoption of responsible beverage service. We provide training as well, in Spanish language training, and I think that's been our greatest motivator.
So you're seeing doing things that are right than just doing things because you're told to do.
Right. The positive incentives rather than the carrot more than the stick. Although the stick's always there, it's just you don't have to keep hitting people with it.
Well, we talked about that in some of our sessions here. Is mm-hmm. that it's doing with rather than doing to, in terms of engaging business operators and patrons to be more a part of a solution that's good for the community. Now, you and I collaborated on a project in Coronado at a Navy base, mm-hmm. where the philosophy was to move away from the liability aspect of it, and also beyond what we would call responsible beverage service, the training of servers, to looking at the broader kind of environmental approach, but on a venue level, mm-hmm. where you're looking at the venue's environment and the factors that you can change. And maybe give a brief summary of what the circumstances were before and some of the changes that took place that led to whatever results you want to talk about.
Yeah, so the Navy study was a fun study. We developed sort of one of the first responsible beverage service trainings curriculum. We didn't know what elements would work best, so we had an extremely long training, I think 20 hours or something of that sort, scattered over 4 or 5 weeks. But what we found when we looked at the venue, we found this is mostly 18 to 25-year-old enlisted Navy sailors, but also they could bring dates to the venue, and also it was open to civilians with some restrictions. It was a kind of a club. It had live music, very large, several hundred people. And what we discovered was that the staff, serving staff, could wander anywhere to serve anybody. And so there was a core group of customers who were getting very frequent service, while those on the periphery would struggle to get seen by the staff and serve them. So we decided for our approach to work to reduce the prevalence of intoxication among the customers, which we had established early on to be about a third of them were at the level that would make them illegal to drive. They were over the limit, the BAC limit, as we could estimate it. So we devised then stations for staff to stay within, so that they would spread out the service throughout the club and not just in the core group, which turned out to be the heaviest drinkers. And we established the training so that they could count drinks and know when to intervene. But importantly, they intervened at the time they gave them the drink, the last drink they could have before becoming over the limit. And they would tell them that we could serve you again in an hour. So it wasn't something like you've been bad and we're cutting you off. It's more like we're looking out for you and keeping you within the legal limit as part of the service we provide. The manager was totally on board with this. He himself had a DUI arrest from coming from another club in San Diego and felt that it was the duty of the business to have protected him against this. And so he wanted that policy in his establishment. We also changed the serving sizes. They had plastic cups and pitchers of beer, and they found that some of the sailors ordered pitchers for themselves and just drank them like a big mug. So we did away with the pitchers. We put in the glassware. It was shown as an upgrade of service. So it wasn't as if we were taking away the pitchers. We were providing classier glassware. And we had 2 sizes of a 10-ounce beer and what was really a 15-ounce, but looked enormous because the glass was so much bigger. So that those who wanted to have a really big glass of beer could buy it. But it was twice the price of the standard size, even though it was only half again as much beer. So they were subsidizing the cost of the beer for the other sailors. Anyway, all of that, and we had to change the way the heavy glassware was dealt with and everything else. All of that resulted in cutting the prevalence of intoxication in half, as best we can estimate it, from, as I said, about a third to 15% among men. Women were already at lower risk, but even among the women, it was approximately 50% fewer.
They also introduced the service of food, so that in the past it was people had to go up and get their own food, but the servers then were empowered to serve food, which increased their income too, right?
Right, and I forgot about this. But that was part of what we wanted to do, was to introduce food, not just, as a safety measure itself, to slow the absorption of alcohol, but as you say, gave them an opportunity to make tips on the food items and not just the drinks.
Mm-hmm. Now, we also collaborated from that study on a project in Santa Cruz and Monterey, which I believe showed a difference, and underlying that was one potential contributing factor was Santa Cruz had already organized a community coalition, and you had somebody who was with the Restaurant Association actively involved in that, a recovering person who understood the risk, whereas Monterey was a lot more scattered. And that was, I think for me, it was an insight that the environmental approach within the venue, which was demonstrated to be effective in the Coronado study, had to include more of a community-wide support system for the venues to engage in these types of responsible practices, but it also was to distinguish the viability of server training alone versus a policy-driven program. Can you summarize what you learned from that?
Yeah, for those who may not be familiar with the two towns, Santa Cruz has an influx of young people, very lively street life and nightlife. We cover Santa Cruz and Capitola. And in the case of Monterey, usually an older crowd and more higher end restaurants, usually a big retirement community there. So the cities were much different in the general ambiance and the general patronage. And as you say, Santa Cruz and Capitola had gone through a lot of controversy about the young people spilling out of these places late at night, creating noise, disturbing neighbors, etc. And so they readily adopted our suggestion for a research project to do this responsible beverage service program. And that was those were the venues that we found an effect, whereas we didn't do so in Monterey, where I felt the owners and managers didn't feel any particular pressure to change their ways. And in Santa Cruz and Capitola, they were eager to demonstrate that they could be good community members. And, obviously, a little more cynically, they wanted to avoid any increased restrictions on operating hours and the like that they were threatened with an unhappy community.
Now, some other work that was done looked at how effective enforcement of serving to intoxicated people worked, or place of last drink tools where you identify in an arrest where people had their last drink. I know Lincoln, Nebraska was really a leader in using that tool. I don't know if it's ever been formally evaluated, but I know the enforcement of selling to minors, selling to underage people, to intoxicated people, was a study that was done by Jim McKnight. And I know that's been replicated since then. But of those two models, they basically are, again, one is focusing in on enforcement, and another is focusing in on identifying risk. So out of 100 venues, rather than trying to focus in on all 100, you have a much more objective measure to see which ones are more potentially problematic. So how has the research covered both of these areas?
Yeah, well, that's a big question. Let me just handle the enforcement first. The thing that people fear is that you're in putting emphasis on enforcement, you're creating some kind of draconian police state, and cops will be in these venues, keep with binoculars to watch out for service to intoxicated people. But really what you need is just enough enforcement to be credible. It's really the awareness of the enforcement that gives you the deterrence value. So just like in traffic laws, you want some amount of enforcement so people know they can't just speed over sections of highway at any speed. They know that there's some level of enforcement, and that helps control the amount of speeding. So in the same way, what you want in enforcement is you want some to be there. And then it's the publicity that gets you the deterrent effect. And the penalties don't even have to be so severe. What really matters is just that the sense that they have the perception that managers, owners, and staff have that they might be held accountable if they serve somebody who's drunk. On the other half of it was
Place of last drink.
the place of last drink data. I know people have made good use of it. Where we've had some difficulty is that it isn't so clear in many communities that there is only a couple of places. It's really spread out more widely. There used to be a notion of killer bars, for instance, that if everybody came from one or two places. But when I've looked at, speaking as a researcher rather than an organizer, for instance, when I've looked at data on places and where DUIs come from, yeah, you could find those who maybe had 2 or 3 drinkers over the span of, say, 6 months, that 2 or 3 drinkers who were arrested, and you'd certainly want to focus on those. But then you rapidly get into places with just 1 drinker or 0, and you can't tell from those numbers that are just 0 to 3 that the ones that are 3 are so much more at risk than the ones at 2 or 1. So you still have to have, I think, a universal approach, even while I would agree that sometimes it's good to focus on those that seem to be at higher risk.
Now, one final question, because you're here at this summit, and this is a Sociable City Summit, so we're really working to emphasize that sociability is what we're trying to encourage at night, and that being safe and having a vibrant experience and being responsible and civil is really all part of what makes that experience more productive or positive for everybody. And now you have cities that are commissioning offices on nightlife. You have police departments that are dedicating officers that are properly trained to work in those districts. You have policy that's working to try to minimize impacts in the area, coordinating late night transportation with Uber and Lyft so people can get home more efficiently and effectively and reduce the crowds that can often lead to fights and disturbances if you don't disperse them quickly enough. So now you have this whole new environmental laboratory of how well will these offices that now coordinate all the city resources aim specifically at nightlife. How would the research community look towards this as a potential area for future research?
Well, this brings me back to that issue about why translational research or implementation research is so complicated. I think we can all agree that coming at the problems of nightlife, entertainment zones, districts, and the like, it's complicated, and you need to approach it from a variety of avenues, just as you described. No one thing is going to be the solution, and coordinating those things really can give you a synergy that you don't get by just employing 1 or 2 things at random or separately. But from a researcher's point of view, this is almost impossible, it seems. You'd have to do, ideally, the research would say, let's take the whole package, all of the elements you want to recommend to create a sociable city, and you recruit something like at least a couple of dozen cities, half of which would do everything that you'd ask, and the other half would be used as comparisons. And the trouble is, there's so many unique features to any of these things. You customize all of this to each of these cities, right?
And there are unforeseen circumstances. So, like, if all of a sudden there's a rash of shootings in nightclubs, you have a whole change in the dynamic of that nightlife. Patrons don't come, more police. So you don't know what the ramifications are from a implementation point of view if you have a situation like that.
And from a researcher's point of view, it's a nightmare. That's a nightmare, not a nightmare. And so what you'd say is typically a researcher would say, oh, well, then just get more cities. Mm-hmm. So now you're talking about a project, we might get 50 cities. The important thing, and I can imagine this conversation with other researchers, they'd say, well, yeah, but how can you do this when each city might do something a little different? So you're not really measuring the same thing, or you're not really observing the same thing. But I think that's small-minded, because what you're really looking at is you're evaluating an approach and a menu of things that allow tailoring to those cities. And I think it's just as legitimate to evaluate that as it is to say, here's this package, it's standardized and it can't be changed, or else you're not being faithful to the original design. So it seems like that's a recipe for poor implementation. Mm-hmm. So all of these things have to be worked out for evaluating how this goes. And again, that's just practically difficult.
Difficult to do it. Well, I appreciate your time. Mm-hmm. You certainly are quite knowledgeable in this whole field, and it's been a great collaboration over, what is it, almost, who knows how long. I can't count.
Over 35 years,
Over 35 years. Well, thank you, Bob.
Thank you, Jim.
And have a safe trip home.
Thank you.